Good morning, everyone, and welcome to this WEO Wednesday webinar. My name is Kirsten with the Illinois Center for Specialized Professional Support at Illinois State University, and I will be the moderator for today's webinar. Today's topic is bridging the gap between substance use, recovery staff, and workforce staff, specifically frontline staff for this session, as this is a two-part session. Just a couple of housekeeping things before we get started. As a reminder, all participants on the webinar are in listen-only mode. And if you have questions as the webinar proceeds, you can please post those in the question or in the chat box or the Q&A box, and we will address them at the end of the webinar during our live Q&A with our presenter today. The presentation is being recorded, and the recording as well as the slide deck from today will be available on our website and on the Illinois WorkNet website within 48 hours. In just a moment, I will put the direct link to the slides in the chat. So that way, if you would like to follow along this morning, you are more than welcome to. Tomorrow, each attendee will receive a follow-up email, which will include a survey asking you about today's webinar. If you could please take 5 minutes out of your workday to provide us with feedback and any suggestions you have. I will also put that same survey link in the chat towards the end of the webinar if you would like to go ahead and take it while the webinar is still fresh in your brain this morning. Just another reminder that if you do have faulty internet connection or are experiencing audio issues this morning, you can feel free to call in using the phone number that was placed in your original registration email. And then with that, I'm going to start us off with our beginning polls that we do every WEO Wednesday. If you're familiar with our webinars, then you're familiar with these polls. But the first one we do every Wednesday is just where's your local area? So if you could select one of the following, we have Chicago, Northern Illinois, Central Illinois, Southern Illinois, and statewide. Pretty broad, but we'd like to know kind of which part of the state, or if you're joining us from out of state, you're joining us this morning. So we'll give everyone a couple more seconds to answer this poll. Okay, so I'm going to share the results with all of you so we can debrief. It looks like most of us are joining from Central Illinois this morning, which is where our center is located. So welcome all my fellow Central Illinoisans. And then some of us sprinkled across Chicago, Northern and Southern, and even one from statewide. So welcome everyone this morning. Thank you for taking time out of your workday to join us. We're really excited about this presentation. And then one last poll is just which partner do you best represent? So if you could select Title I, Title II, 3 or 4, or if you best represent other WEOA partners and stakeholders, or our state or local workforce innovation board. So we'll give everyone a couple seconds to answer this poll as well. Okay, so most of us are joining, over half from Title I this morning, which is great. And then some of us sprinkled across the other WEOA partners and titles as well. So again, welcome everyone. We have a great presentation for you today with our presenter, Kathleen Burke, and I'm going to hand it off to her. She is going to share her screen and present to us this morning. So welcome, Kathleen. Kathleen, you want to go ahead and unmute yourself as well.
Get rid of that. Good morning, everybody. Kirsten, you can hear me fine now?
Yes, we can.
Okay. Thank you all for tuning in. I'm very excited to do this webinar, and I'm anxious to get your response to it. There we go. There are some learning goals that we're going to work with, and I think the first thing I need to do is hide this video from me because okay. Because it's interfering with my slides. Anyway, So today I'm going to define for you what a substance use disorder and the recovery process is. You're going to learn what the purpose of a recovery coach is and the strategies that we use to support a client. I'm going to describe the challenges that we have with clients who have a substance use disorder in obtaining a job, and then describe the similarities and differences between a recovery coach and a workforce career counselor. I will also be describing what working together looks like for recovery and workforce. This is a really exciting type topic because it's very new, and I'm anxious to be sharing this with you. So the first slide is just a sense that you get about the epidemic and substance use and where we're at in this country. As you can see, the largest number of substances right now that are in the marketplace are synthetic narcotics, meaning fentanyl. Fentanyl is different from heroin because it is made in a laboratory. Heroin is poppies that are processed, pulled in the field and then processed. So the replacement of fentanyl for heroin has had a devastating effect on our community. And that continues to increase, particularly during COVID. We've seen a 30% increase nationally on overdose deaths. This is just a picture to give you a sense of the increasing numbers, and where you'll see the yellow line is the synthetics, and the fact that heroin is dropping off, but it's not in reality, because an opioid is what we call it now. So opioids are heroin, synthetic narcotics like fentanyl. We use that term because it's broader. It's no longer the heroin epidemic, it's a opioid epidemic. So is a substance use disorder. And we use that terminology very specifically to avoid stigmatizing anyone with this disease. It is a disease, it is not a personal failure. And I encourage all of you to be respectful, no matter what your experiences are with someone with a substance use disorder at your workplace. It's very important that we give each of our clients respect, no matter where they're starting from. So a substance use disorder occurs when the recurrent use of alcohol and drugs causes clinically significant impairment. That means health problems, disability, and failure to meet major responsibilities at work, school, or home. That gives you a sense that it's a life, people's lives just stop and they function very differently. They're overcome by the presence of a craving for that drug. They've lost control over the amount or frequency of the use, and they live every day with a compulsion to use. That compulsion to use is what drives people to continue to use to the point of overdosing. The brain has been impacted by that addiction, and when the brain changes, all someone thinks about all day long is, I need to get my drug of choice. I need to get my drug. I need to get my drug, regardless of anything else that's on their agenda for the day or responsibilities as a parent or a worker. The brain has shifted. And this is important because sometimes I think people believe that someone's behaving in certain ways just because they're being rude or non-compliant. In reality, their brain has been affected by the drug. They're not thinking the same way that you and I are, and their thinking is not clear. When you use a substance like an opioid, what happens is you develop a tolerance. So let me give you an example. If you've had an injury, say you broke your shoulder like I did, and you're prescribed pain medication. You're given pain medication for a short period of time, not a long period, but just a short, maybe a couple days. And we've changed that. It used to be, oh, let me give you 30 days of pain medication for your shoulder that might hurt for 2 days. So now we give people 3 days. And you take that medication and you take it the way you've been asked to take it, and your pain goes away. Now, let me talk about someone who has chronic pain, possibly a chronic back pain or neuralgia or some kind of neurological disease. That pain never goes away. So when you're taking an opioid, you develop tolerance for that opioid. The first time you take it and you get pain relief, you will never get that same pain relief again, because the longer you take it, the less it feels like your pain is being lessened. That's the problem with the drug. And that's why it's so dangerous, because what happens is people start to misuse it. They take it in a way that the doctor has not prescribed. So something like, and I know we've probably all been there, you take 3 Tylenol instead of 2 because your migraine is worse than what the directions on the label say. So that's misuse. If you don't continue that for a long period of time, you won't hurt yourself. But with someone who has a chronic pain, they will start to misuse taking it more frequently, and they develop a physical dependence, meaning if they stop taking that drug, they will have withdrawal symptoms. They will feel, besides their pain that they have, they will also feel physically sick from not taking that medication. That physical dependence drives people to continue to use because they don't want to feel uncomfortable. That drive to continue to use is what ends up becoming a full-blown addiction or a substance use disorder. That's someone who uses every day, they use more than prescribed, and they can't be without it without being seriously ill. That's where you have the loss of control and the frequency and the compulsion to use. So that's, I think, a good example or a description of what happens when someone has a substance use disorder. Dr. Nora Volkow is a significant person. She's the national director for the NIDA, National Institute of Health. She describes it that what's instrumental in demonstrating that drug addiction is a disease of the human brain. Again, this cannot be negated. That doesn't mean that there are not behaviors that can be managed, but the brain needs to heal. They pioneered the use of brain imaging to investigate the toxic and addictive properties of abusable drugs and found that it seriously affects the dopamine system. The dopamine system is the part of your frontal brain that gives you motivation and self-regulation. So it's a pleasurable area of your brain. The more dopamine you make, the more pleasurable you will experience activities and feelings. And that's what's dangerous, because feelings that are improving with that drug will then remember that, and they will continue to use because the person does not want to feel badly. So the medication takes on a different kind of effect on them and an importance to them. So here's a picture of the brain. I think it's important to see that all types of users, not just opioids, but meth users, cocaine users, it all affects the dopamine system of the brain and changes it. So here's a healthy brain. You see the yellow and orange highlighted. Well, here's a meth user brain for 1 month. You don't see any orange spots in there. It is not functioning in the same way a healthy brain is. Now here's the meth user after 14 months of abstinence. His brain is healing. You see the orange sections, they came back after the lack of use, but that's 14 months. So healing takes time. We always say that we don't know if someone's brain is going to heal completely or how it's going to be changed in the long term. But we do know that it's a brain disease, that the drug has affected the brain in a negative way. The other thing that's important to remember, it's chronic. So once you develop a substance use disorder, you have a substance use disorder the rest of your life. It doesn't go away. It's not like having the flu and then it goes away. It's more like having heart disease or other type or high blood pressure, something that you need to take care of the rest of your life. So what's really interesting is, and this happens all the time, if someone is diagnosed with high blood pressure, what happens is they take their medication and they do what they're supposed to do, watch their diet and get exercise, and they feel better, and their blood pressure has reduced. It's back where it's supposed to be. And the first thing they do is they go off their medication. Well, the reason that that their blood pressure is better is because of the medication. So they can't not take it and expect to have a healthy blood pressure. And that's a very generalization, okay? But what I'm saying to you is that you never get rid of your high blood pressure. It needs to be managed. You never get rid of your substance use disorder. It is always going to be with you. So you need to manage it. Occasionally people will relapse, meaning they will use again, and then they could go right back into recovery and stop using. But that is common among folks who are in recovery for a long period of time. So it's chronic. It's just like diabetes. You have to take your insulin or it will not, you will be very sick. So how does that person develop a substance use disorder? Why does it affect certain people and not others? That's being studied a lot because, again, when we realized that it was not a personal failure, we had to take a look at the science and figure out, well, so what's going on here? And the first area that we look at is genetics. So if you have a family history of any type of substance use within your immediate family or your grandparents or their parents, you have a genetic predisposition. Now, that doesn't mean that you will develop it. That just means that you have a 50% higher probability of developing that addiction. And those addictions, you could have a long history of alcohol disorder in your family. That's what I have. I'm Irish, right? So alcohol is part of what you experience when you are celebrating, when you gather family, when you go out for an evening. It's part of the community. And so there are situations where people have an alcohol use disorder. They can't stop drinking. They can't have just 2 drinks. They crave more and they crave it more frequently. And so if that is in your family, you may develop alcohol use disorder, or you may develop an opioid use disorder or eating disorder. It's all in the same part of the brain and it's all addiction. So it's really important that families have discussions about what's going on because especially if it's common practice, like it is in my family, to experience situations where people have overdone it, have drank too much. And, your parents tell you, oh, that's just Uncle Tom. He's just having a good time. He's fine. Well, no, that's just not Uncle Tom. He's having a serious problem. But we diminish it and we minimize it. We certainly don't talk about it. We need to talk about it because if you have children, anyone who's going on, the earlier you start using a substance, the more likely you are going to develop a substance use disorder and the earlier you will develop that addiction. Excuse me. The secondary factor is a mental health disorder. If you have depression or a type of disorder that makes you feel uncomfortable, you're going to self-medicate. But if you have a mental health disorder in combination with your substance use, the combination is important to acknowledge and to treat. So if you have mental health disorders in your family, whether it be bipolar disease or depression, even schizophrenia, that will, again, predispose you to substance use. The other thing I'd like to mention about that, in the past, we looked at addiction and mental health disorders as separate entities. You had to treat one and then you treated the other. It's not the case anymore. They're both intertwined. And so we treat both at the same time because they directly influence each other. So besides a mental health disorder, the third factor is environmental factors, including adverse childhood experiences. So what does that mean? It means if you live in a home where someone in your home is using, you are more likely to use at some point. It's very common that even parents, brothers and sisters, cousins will offer another family member the substance. And it's not unusual for families to use together, unfortunately. If you socialize with a group of friends who use, you are more likely to use. If you live in a community where it's easily purchased, or you go to school and you know who the drug dealer is, that influences you. But the most important one that we found that is impacting today, the research, is adverse childhood experiences. What that means is if something traumatic has happened to you as you were growing up and your brain is developing, like if you lived in a home where there was domestic abuse, if you lived in a home where there was substance use, if one of your parents was incarcerated, if you were physically or emotionally abused, those experiences leave an impact on your brain. There's an imprint there that occurs as your brain develops. That imprint affects the way you respond to different types of situations as you grow older. That imprint can also be passed along from your parents. So if your parents had those experiences and you didn't, you can still be affected by their genetic imprint. So it's important that we understand that it's not just the here and now, it's actually the history, genetics, and mental health that influences whether someone may develop a substance use disorder. Now, I want to be clear, it doesn't mean that you will, it just means that you have a higher probability. So what happens when you have a substance use disorder? What does treatment versus recovery look like? So treatment means, first of all, you have to withdraw from the substance. And this is tricky, especially in our community. We don't have a lot of places anymore for people to medically withdraw from the drug of choice. If someone is withdrawing from alcohol or benzodiazepines, they have to do it in a hospital because the impact on their body could create a situation where they may die. Most other drugs, they do not include that at the hospital. They stabilize you if you come in with an opioid overdose and they discharge you. So you have to withdraw from the drug one way or the other, whether by yourself or within a controlled environment. There's residential treatment, meaning someone is staying in a location, most often for 28 days, and they are being taught skills and support. They're being provided support to help them with their recovery. The next step is an intensive outpatient, meaning somebody goes to outpatient care 5 days a week. So you'll be living somewhere else, but you have to go to care 5 days a week. That gets, that timeline is dependent on your needs. And then you transition to outpatient. Outpatient can be at the treatment center where you were residential, or it could be your own clinical therapist. But it's important that you continue that, and that's supposed to be continued for 3 days a week. The other thing that's in the middle of that is if you have an opioid use disorder, you can also be given medication-assisted treatment. That means you are either taking methadone, buprenorphine, and injectable naltrexone with counseling. Now, this affects people trying to look for a job tremendously. As we know, methadone has been around a long time, and many people have very negative stigma around methadone. But methadone is very helpful to people who have cravings for opioids. But the problem has been they have to go every day for their methadone. Until COVID, nobody sent anybody home with methadone for more than a week. And that's only after you've been stable. So with COVID, we've relaxed those rules, and those were federal rules. Those weren't medical rules. And people can go home if they're stable. They can go home with a week to a month's worth of methadone. We've had some relapses in that situation, but it's so much better. But my point is, someone has to in our area, there's only one methadone clinic in Joliet. So if you're in Will County and that's the closest one, you have to go there at a certain time of the day. And so trying to work that around your work schedule or trying to come in to see a counselor, it's impacted. So that's just a FYI. Buprenorphine is something that you take every day. It's a medication that's very effective, and it doesn't require the same kind of restrictions that methadone does. And then there's an injectable Vivitrol, you might have heard of that. That's a non-opioid medication, and that injection is given every 30 days, and that reduces cravings. Some of these work for some people, some of them work for others. It's not a one-stop shop. It's all dependent on the individual. And they only work long-term if someone is also in counseling. Behavioral therapy is very important during this whole period. People have gone through some very stressful situations. They're traumatized. They're ashamed. They stop and are appalled at some of the things they've had to do in order to support their addiction. And I want to stress this. Nobody's proud of their behavior. They realize it's a disease and they want to move forward. So what we need to do is help them move forward in recovery so they feel confident that they're back on track of living a fulfilled life. The support that is needed is support groups like AA or NA or other types. There are other types of support group. And then we're looking at now relapse prevention. So someone who's living in a sober living home, that provides the support someone needs in order to continue in their recovery. You're surrounded by people who are also in the same situation. You socialize with those folks, and you don't run into the situation where you're going back to your old neighborhood, hanging with the same people who will influence you to start again. So relapse rates for people vary. And again, I want to stress here that because addiction is a chronic disease and a chronic illness, people will relapse. In the same way, if let's say that your hypertension, again, feels bad, feels good, and you don't want to be on the medication, so you stop. All right, that's what we could consider a relapse. Or the medication makes you feel not very good, and you don't want to do that, so you go off it. So along those situations, you stop doing what's good for you because of a side effect that something is happening. That's the same thing that substance use disorder has to deal with. If you've had a crisis, let's say a parent died or a very close friend, and I have to tell you that people who have opioid use disorders have lost a lot of friends. That may impact you, and you might slip and use again. Sometimes people use the same drug of choice. Sometimes they drink or use some cocaine or use something else that they didn't use before. But what's important is that we support them to get right back on their recovery journey and continue. So recovery can last a lifetime. It's not a short-term event. It is part of your journey the rest of your life. Because addiction affects so many aspects of a person's life, treatment needs to address that. So that's where our recovery coaches start working with people. Recovery coaches are not counselors, but they've been trained to help a person get their life back, meaning a job, meaning actually, even before they get a job, often they need to get their driver's license. They need ID. They need their birth certificate. They need a lot of supporting paperwork that they've lost over the years. And they need housing. And they need something to do in order to pay for that housing. So there are very important things that have to go on before a person is considered functioning the way they did before they started using. Stopping the drug use is just one part of the complex recovery process. It's only one part. So people have physical health issues from their use. Their families often have disown them. They don't want anything to do with them. And they have very little support in the community. So these are all things that people are struggling with. And if they're involved in the court system, which often they are, that goes on for a long time where they have to clear up cases, they have to go to court. And again, all of these things are interruptions in the daily life of a person. So it's not an easy road, but it's a road that can be mastered, and just with the right support, recovery will continue the rest of their life. So here are all the things that a recovery coach helps people with. This is the clinical side inside here. On the outside are the things that impact an individual when they are trying to get their lives back. Now, you need both, right? You need an advocate. This is not a sponsor either, like you have in an AA meeting. These are advocates. These are the folks that are going to help guide you in how to take care of these things. They might give you a ride to your therapy appointment. They might help you figure out how to use public transportation to get where you need to go. They might help you with putting a budget together. And they might direct you to legal aid. They might help you start the process of getting your children back if they have been taken away from you. All of those things are what a recovery coach works with. And they're a valuable asset to a job counselor because a lot of these things will interfere with a person's ability to get their career back or just get a job. When we're talking about people in recovery, getting a job starts at a lower level than they probably left. They might be college educated, but they haven't worked in their career in a long time. Well, they're not going to jump back into that career. They're not, they don't have the experience, but they're also, it's not a good idea when they're early in their recovery. They need to start in a lower level position so they can pay their rent. Sometimes they don't like that. It feels very demeaning, but the recovery coaches help them with that. They are lived experience people who can help a person see the outcome of following this path. So a recovery coach promotes recovery. They remove the barriers to that recovery, and they're a person's personal guide and mentor for people who are already in recovery. They're not clinical, they don't give therapy, but they assist the therapist with helping that person in continue on with their life. They help them navigate the addiction treatment world, okay? It's very hard to figure out where to go for care. Where can I go for meetings? Where can I go if I need one-on-one therapy? That's hard. And so these folks have that expertise. This is the wellness wheel that we use that describes all the different things and what we're helping people with. So one of the things that is important is that a person needs all of these to have a healthy life, but they're broken, and in some cases more broken than others. And so the process of recovery helps build those back together. So as a job counselor, you will see a person with a substance use disorder in a way that you come in, you do the assessment of what they need, and you give them responsibility, homework, so to speak, or things to do, and it doesn't get done. Why? Most times you'll think, oh, that person doesn't really want a job. They're just manipulating me. But let me talk to you a little bit about what that person is dealing with. First of all, they may have, first of all, their disease, their substance use disorder is a chronic illness. They have to manage that all the time. They can't say one day, I'm cured and I'm just going to go about doing things like everybody. They can't, or they will relapse. Healing the brain takes time. It absolutely takes, when you think about if you've broken a bone, that takes time. And the older you are, the longer that takes. So your body has to heal and the brain has to heal. This is a new understanding about the brain healing, but you can't have surgery and go in and fix things. It has to take time and heal over time. Their self-efficacy and the belief that they have the ability to implement the things that you're desiring them to do is impacted. They are at the lowest level that they've been at with confidence in themselves. And the ability for them to complete directions and implement behaviors to find a job is challenging at best. And if there's a mental health disorder on top of it, let's say someone's depressed also, then it's really hard to be doing these things. But we want people to take small steps and keep moving. And with support from each of you, with guidance, as well as reinforcement, people all will be successful. You start small. You give people small goals. You don't give them something big to do because it won't get done, because the brain can't handle that kind of complexity yet. So some of my folks will start having people write lists of the things they have to do, because a list is something they have with them at all times. So if they do forget, they have the list. Now, there's a lot of resistance to that. I've heard some people say, that's childish. I'm not a child, I'm a man. I can do these, I can remember these things. Well, that's not true. And then they fail, and then they feel even worse. So it's important to help people understand that they will get back to where they were, but you got to start small and do the little things that build your system back. Clients absolutely need support systems. They have to be surrounded by other people who are in the same situation they are, because they see themselves through other people. They hear the stories from other people and they learn strategies to continue in their journey from other people. And when they fail or have a hard time, that's the first people they call, because you want someone to not feel alone. You want them to feel that they have a community surrounding them. Transportation is many of people with a substance use disorder have lost their license. They certainly don't have a car, and driving to get anywhere is a challenge. So we try and work with people to get their initial employment around where they live, because they have to be able to walk or get public transportation. If those things don't exist, then they're not going to be able to get to work. I know there were some great jobs for people, but they had to drive far away, and they couldn't. And then remember, I told you that, let's say it's somebody who has to go to a methadone clinic every day. Well, that's going to impact when they can get transportation to that location and then get transportation to their job. It's important to understand that just basic life is a stressor to people at this point, and especially in early recovery. You have to remember that early recovery is they're learning skills, but they're not solidified. They're still very challenged by life and trying to build a life without using, and that's very different for them. So they need to gain some confidence in that, and that takes time. It takes time to build the resilience that they need to continue on their journey a lifetime. It's a chronic illness that requires a lot of skill building, a lot of support, and a replacement of that confidence and resilience that they may have once had. So we talked about that, okay. Here's another challenge for someone with a substance use disorder. Addiction affects multiple brain circuits, okay? It includes those with reward and motivation, learning and memory, inhibitory control of behavior, long-term drug use changes those, and especially if someone's done that for a long time. So the kinds of things that make a person feel good and reinforce are different. They're not the same as you and I. They're not the same, rather, you can look at getting one interview might be really, really critical and just so engaging to the person. The problem is they don't know what to do on the interview. So then we need to stop and make sure they're prepared. Dysfunctional behaviors that develop because of the substance use can interfere with a person's normal functioning in the family, in the workplace, in the broader community. People are relearning how to live. They are relearning common skills that you learn as a child. One of the things you need to know is that when a person starts using, let's say they're 16 and they start using, their development stops, okay, if they continue to use. So that continuation of growing up and growing into an adult is stunted. So you will often feel like you're dealing with teenagers when you're dealing with a 35-year-old person, because their recovery needs to put back all the things they lost during that period, all the growth, all the growing up, all the mental capacities that people have as they get older. Their frontal lobe needs to grow in their decision-making so they make better decisions. So you can count on things being a little different for people who have a substance use disorder, and it's important to know how long they've been in recovery, because it makes a difference. It also makes a difference in their reality and you understanding that they may think they're fine, they may think that everything's taken care of, and then in reality it's not. Research indicates that most people with a substance use disorder need at least 3 months in treatment to significantly reduce and stop their drug use. All right, there is no such thing as 3 months in a treatment facility. There are some long-term programs, but they're not covered by insurance. So we know this all takes time, and we're trying to build those resources so people can take the time to do it. So our coaches do not assess, treat, or diagnose addiction or mental health issues. They are told by the clinical people what it is. They are not going to be diagnosing folks. They're not trained, it's not appropriate. And I make sure when we're first training our recovery coaches, that's one of the most important things that we tell them. You do not think you're a clinical counselor, because you're not. They're resources, they're pathways to recovery. They go beyond a 12-step sponsor because they're trained to use non-confrontational motivational strategies to promote engagement and retention and treatment. They're there to keep people moving forward. They're there to remind people that the rules count and that positive change is reinforced. But even more importantly, they walk the same path that the folks did. And in some cases, that's really important. It's important for people to think that you were in my shoes and now I'm going to look up to you and we're going to get through this because you know what I'm going through. And that willingness to help people with boundaries, to be very non-judgmental towards clients, and help people continue to build their sense of self and resilience and credibility and self-esteem. Career counselors help identify the factors influencing your career development. So you will understand some of the things that are getting in their way. You help assess interests, abilities, and values. We don't do that. A recovery coach does not help them figure out what they could be, what their career path is. They rely on you folks to do that. They will get the person to a career counselor. They will help them analyze the information and do the work that you're asking them to do, but they do not have that expertise. They can recommend jobs that they may have started in. That's a good place for someone in recovery to go, but we're talking about very simple level jobs. We're not talking about the rest of their career. And in working with them, sometimes you have to build that. You have to start small and continue to build. And being one of those support people can be very satisfying as you watch a person grow in their development. So this is the point in time where I talk about some of the cases you might be having, and we need to have more interaction. I'm going to skip that for a moment. And there's my information for anybody, so that you can contact me at any time. We have this great project going with Workforce. I'm so blessed to have been able to have this project and learn how we could work together. It's not common that substance use areas work with Workforce. So this is unique. This is an opportunity, and it's very exciting to be able to do this. Now I'm going to stop sharing. And I think we have some questions.
We do have a couple, yes.
Okay. So hello, Pat Durkin, State Bonding Coordinator. Here is a program available to substance abuse job seekers. The program is at no cost to job seekers and employer, federally funded. For more information, contact me. Thank you very much, Patrick. I'm going to suggest that we use the term substance use and not abuse. That's language that we're trying to get away from. Just because if someone's in their active addiction, then they're abusing. But when they're in recovery, they have a substance use disorder as a disease. So thank you. I think that's okay. That was the only.
We don't have any other questions right now, Kathleen, but while we're waiting, attendees, if you do have questions, please post that in the chat. Kathleen, I have someone who's asking for you to put your email up again.
Okay.
So if you could do that, we'll have her put up her contact information again. And if you do have any questions for her right off the bat, feel free to type those in the chat or the Q&A right now. And then I'm going to go ahead and put in the chat to everyone our follow-up survey. If you have a couple minutes after this session, please feel free to go ahead and take that for us and provide us any feedback. You'll also get the same survey in your follow-up email tomorrow. And you can also click the website where you can find our upcoming webinars and recordings. Kathleen is presenting on the second session of this series on February 24th, I believe, at 1 o'clock. And you can register for that on our website if you are interested in that as well. And then, Kathleen, did you want to go ahead and share your screen with your contact information? No, you're fine. Yes, Kathleen is presenting on February 24th for administrators specifically, and it will be at 1 o'clock. So you can go ahead and register for that. And then there's her contact information. And we did have one question come through, Kathleen. How are clients referred to you?
Oh, through the recovery coaches. We have recovery coaches assigned. They're in training at different agencies. So the agencies where they're going for care. So they get referred to a recovery coach through their living situation, their recovery home, through treatment facilities, outpatient, a lot of outpatient. So we work with Gateway, we work with Cornerstone, which is both a housing location for people with a substance use and mental health disorder. We don't do things, I think what you're asking is, are we available for referral for an individual? And we don't do that. It's not a freestanding business. What it is a training program. And if somebody is interested in starting that, or how did we do it, and we did it through this grant, I'd be happy to talk about that. If someone is looking for a recovery coach and they're in counseling, we can help with that also. But we're not independent. We're work through our agencies in order to support the agency. I'm not a big believer in the independent recovery coach because it feels like independent nursing or independent. I would rather see like a visiting nurse business that then recovery coaches based on their treatment facilities are asked to come in and help with clients. But it works all different ways all over the country. I'd be happy also to, if anyone has had a problem with someone who has a substance use disorder and it's challenging for you, to please share, because this is an opportunity, one, to share the frustration, because there is frustration. I do not want you to think that this is always fun. In fact, it can be really frustrating, particularly when you're dealing with someone who's older but isn't behaving as an older person. It's like having teenagers again. And but once you get used to that, you'll work well with them. But anything else that, and how you felt if a person did relapse while they were working with you, anything like that.
Kathleen, we have another question. Are recovery coaches volunteers or are they paid?
No, they're paid. We pay them. There are people who volunteer who are in recovery through their support systems. That's not the same thing. These are recovery coaches who have taken a class through Governor State University, learned the techniques of working with it, and we supervise them right now because they're interns. We pay them $15 an hour. So that's kind of the.
Okay, and then a follow-up question to that is also, you said they weren't clinical. Does that mean that they're recovered as well? And I believe you just said that.
Oh, they're in recovery. Yes, yes. And when I say they're not clinical, I mean they're not a therapist who's doing treatment. CACD, clinical therapist. They're not doing the therapy side of care for this client. They are people who are either in recovery or had a family member who were in recovery and have experienced the situation, but they've been in recovery for at least 2 years. It's important that if you are hiring recovery coaches, that you do not use someone who's too new in their recovery, because if they're not yet what we consider really sound. They'll tell you they are, but it's still, we want a little bit more behind that. And if they relapse and they're working with a client, that's not a good situation. So we want someone and we want the people who are committed to doing this. I got to tell you, the folks that I'm working with, I've never seen such great, kind, caring people who want to do this kind of work. This is not something they're doing because they got a job and they're doing it. They want to do this kind of work because you don't make a lot of money doing this, but you have to be able to set boundaries. That's really important, because boundaries when you have a substance use disorder are challenging. And so you need to be able to set boundaries yourself before you can teach somebody else to do that.
Okay, great. Thank you, Kathleen.
So sometimes you'll hear peer support specialist is also a recovery coach. There are different names out there for them. But if they're all identified as helping someone in with their life skills, that's what it means.
Okay, thank you so much, Kathleen. We don't have any other questions coming through right now. I did want to put a plug in for our next Wednesday WIOA webinar. We have another one today as a double feature. We have one at 1 o'clock today. You will hear from Skills for Chicagoland about careers in demand pivoting in a pandemic. And that is also the first session of a 3-part series. Again, Kathleen will be presenting again on this substance use initiatives and substance use work and how it affects the workforce, again on February 24th. specifically relating it to administrators. And if you'd like to register for either that 1 o'clock session today or Kathleen's second session or any of our sessions, you can follow or go to our website and register through that. As well as you will receive the marketing emails that are sent out every Monday with those registration links as well. And then this session was recorded, and the handouts and recording can be found on the website that I posted in the chat, and you will receive that direct link and the link to the survey tomorrow morning in your follow-up email. And with that, did you have any final remarks, Kathleen? We don't have any other questions that have come through.
No, thank you very much. I hope you've gained something from this webinar. If not, I'd like to let Kirsten know, because I want, if there's information that you would like me to add to it, I would be happy to do that.
Absolutely, yes. If you have any information that you would like Kathleen to cover in the future, she does have that second session on the 24th. So please take that follow-up survey, and there is an option for you to put any kind of comments in there. And I can give that feedback to you, Kathleen, after we have some attendees take that survey, and then you can incorporate that potentially in your next presentation.
Great, great.
Okay, and we have some outstanding and thank yous coming in for you as the presenter, Kathleen. So thank you so much for your time today, and thank you again to all of our attendees. And we will see some of you back here at 1 o'clock. Thank you, everyone. Have a great rest of your Wednesday.
Thank you.